Hello everyone. So we would be starting with chapter 18 of cardiac disorders, illustrating textbooks of pediatrics, starting with the recent developments in pediatric cardiac disease. Congenital cardiac disease are increasingly identified on antenatal ultrasound screening. Over 50% reverse 80% of severe lesions. Most lesions are diagnosed by echocardiography, the mainstay of diagnostic imaging. Many diagnostic imaging involves three-dimensional construction of complex cardiac disorder, assessment of hemodynamics, and flow patterns and assist interventional cardiology, reducing the need for cardiac catheterization. Most defects can be operated by definite surgery at the initial operation. Increasingly, number of defects 50% are treated non-invasively, such as persistent PDA, persistent ductus arteriosus. New therapies are able to treat pulmonary hypertension, delay by transplantation. The overall infant cardiac surgical mortality has been reduced from approximately 20% in 1970 to 1.8% in 2016. Epidemiology heart disease in children is mostly congenital. It is the most important common single group of structural malformations. In infants, 8 per thousand live births, infants have significant cardiac malformations, 30% which require intervention in the first year of life. Minor abnormalities of the cardiovascular disease are present in up to 53.2 per thousand live births. A pike is where to call the metaphor screening in up to 5% live births. About 1 in 10 stillborn infants have a cardiac anomaly. The 9 most common anomalies account for 80% of all lesions, but about 10 to 15% of complex lesions with more than one cardiac abnormality. About 10 to 15% also have a non-cardiac abnormality. Most common congenital heart disease, left to right shunts, breathless, VSD, persistent arterial duct, and ASC. We see 30%, persistent is 12%, which is supported as some say right to left shunt, blue. Babies, tetralogy of Fallot, 5%, transmission gate traffic also 5%. Common mixing with losing blue, atrial supplement complete, it's 2%. After obstruction in well child, asymptomatic with a normal pulmonary stenosis, neurotic stenosis. Other obstruction is sick, neonate, collapses, shock, optician of and 5%. Etiology is genetic causes increasingly recognized in the etiology of congenital heart disease, now in more than 10%. These may affect whole chromosome point mutation, magnet deletion. Cardiac screening should be part of care of children with multi-system genetic disorders. Polygenic abnormalities probably explain why having a child with congenital heart disease doubles the risk for subsequent children with the risk is higher still if either parent has congenital heart disease, small number related to external genetics. Circulatory change of the fetus, the left atrial pressure is low as relatively little blood returns from the lungs. Pressure in the right atrium is higher than in the left as it receives all the systemic return into blood from the placenta. The flat valve of the foramen ovalis has open blood flows across the atrial septum into the left atrium and then into the left ventricle when it turns pumps it into upper body. This is in the picture. Changes in circulation of fetus in newborn with congenital heart disease rely on blood flows to the duct. A duct when circulation there will be dramatic deterioration in the clinical condition of the duct flows. With the first breath, resistance to pulmonary blood flow falls and the volume of blood flowing through the lung increases sixfold. This results in a rise in the left atrial pressure. Meanwhile, the volume of blood returning to the right atrium falls as the placenta is excluded from circulation. The change in the pressure causes flat valve the formula to close arterial ducts. If the arteries connects the formula artery divider and fetal life will normally close within the first few hours, but there is some infants with congenital heart lesions rely on blood flow through the duct that doesn't circulation. The clinical condition will deteriorate dramatically when duct closes, which is usually at 1 to 2 days of respiratory related. Causes of congenital heart disease, maternal disorder, infection, SLE, and diabetes, and some kind of maladies due to these disorders are peripheral polyposis PDA in sustained complete hydrogen and the bodies. Frequency is 35%, 35% massively, that is metacentralism is overall 2%. Those that warfarin therapy by osmosis PDA at 5%, which alcohol syndrome is to be socially first in fact. Normality stance in the 2021, due to medical separated by BSD 40% of the syndrome trisomy 18 had less sensitivity to 80%. Chemo, such as homocysteine or sleeping, however, is associated with a fall in arterial blood oxygenation. It can only be recognized clinically if the concentration of reducing blood blood exceeds 50 gram per liter. It is less pronounced as hypertension. Check with the blood swaps, but infant situation is normally 1994. This is some issues in otherwise when infant is nearly out of the same structure. Right? Disease. So this is a new one that is going to distress, is going to do more than 60% need with the cardiac disorders. Scientific consultant how these going to decide is going to distress, affecting food, seeing the very aspiration, the very hyperphagia. This isn't when we have to say we want feeling from the aspirations is a fact after birth. And infections of the CFP, dancing with blood spaces in shock, the very percentage representing heart disease is with a heart murmur, heart failure, sinuses, or shock, depends on the underlying anatomical lesion causing left right and right lesson culminates with after traction labor of child, sunrise and level TDB, just dead, conjecture heart disease is suspected. But just radiographic ECG should be performed on the really diagnostically, maybe helping establishing the brain in the regular serious and baseline for assessing future changes. The choreography combined with doctors, designing with almost all causes of congenital heart disease to be diagnosed, even when a pediatric cardiologist or pediatrician even with reason. In cardiology is not a regulatory specialties of the choreography could immediately available tele medicine. All else possible cardiac center will be necessary. An urgent specific opinion is required if the child is independently unstable, if there is severe heart failure, if there is cyanosis, when the oxygen saturation is less than 94% due to heart disease, and when there are reduced volume pulses. This is case history. Shock, a 2-day-old baby has been discharged from the day after delivery following a normal routine examination. Second collapse and was rushed to hospital in the speed with new lips. Right wicked test could just be filed and 50% intravenous liver markedly large. Blood gases show severe metabolic TDs are congenital heart disease, severe in one eye, he's ventilated due to providing support that the taken and liver is started to with sepsis. And blood nutrients associated with following minus screen in urine for atomic acids as a form of passage may impacted by second infusion was started within 2 hours which can like the fusion acidosis is a severe fracture held as diagnosed echo. He had developed shock from the left head outwards chapter section and surgery back to heart. Firstly, glucose containing lactobacillus disease, the early survival units with bacterial circulation, lactobacillus partitions, science circulation maintained by platform right to left across the Dr. Saturated Dr. System circulation, heart failure, a 5 feet momentum, which I could do hospital because of reason to feed into weight gain during the previous 2 weeks. Before this, you had been routine neonatal examination in normal stage equipment. 50-60% low. There was some stirring in the vascular session because normal there was still passes out of the lower legs and the range and slightly exonerated from the component of those sediments. The scattered users was a large calculator human based below the personalities which are unlikely just really touched with carbon Italian peace planning was being markings and he kind of issue moderate size VS team, deep most medical diabetic electrical VS tools, spontaneously added demons, this infant develop heart failure and moderate VS presented a certain use of waste and the problem is the cell causing increased left to right strength of the blood defectors spontaneously. ECG insulin have a feature of your superfluous access negative effects in AVF and right of the laboratory to apply period the lead on over 1 month age, left hand strain, inverted periods and P6 and pitfalls, medium menopause is really helpful when children households are going to grant of mixed on normal children and the responding case to the something like sending severe responding normal. So in normal social, the European is a Christian medical system in the main concept of how disease across sequential segmental arrangement. The advantage is that it's not necessarily the pattern of any pulmonary illness syndromes and fellow disadvantages that belong with it. And the idea is that each company is solving term, meaning the build and then the explores, and then the data is connected. Hence, phenomenal hardware use psychosologist is API with correct communication, encoding 1890 connection, and concordant configuration connection. Therefore, hard of ways to treat can be described in logical step-by-step process. This is not so that is in the display. So this is the hobbies is individual device screening, increasing precaution, detective function, mating, and detection partner need to differentiate the social aspects of newness, science impact of personal testimony, doctor densities, working condition survival, heart failure usually from left to right, shunt and years can shock when that poses in a severe left heart obstruction of resuscitation, extremely critical congenital heart disease. So from left to right shunt, these are ASTs and PDAs, and starting with AST, two main types, secondary AST, 80% of AST, and primary partial AV septal effect, which is ABST at primary, AST less common. It was in the similar syndrome signs, but the anatomy is not different. Secondary AST is affecting central due to second involving the foramen environment. Partial AST is affected that the septum is fertilized mainly where actually and 20% in the bottom electrodes suffering only was carbon, ST, and abnormal PT ventricular valve with the left PT ventricular valve, which has seen effects and tends to be recurrent in the out. And clinical feature symptoms non-commonly with a current chest infection these and it may have 4 data parameters. Physical signs, it is a solid northwest head at the upper left sternum as it increase the cross from the right from left to right and it fits on the widely split second heart sound from the perpendicularity to the right ventricular stroke variant being equal in both inspiration and expiration with the costly university and after the past solid normal behaves in 18 ventricular valve with vegetation investigation is just really bad. Shows cardiometabolism in the last venue actually increased by muscular markings. ECGs, second university, partial valve, this is from the knee upper and normal cilium, and the right acceleration due to right ventricular enlargement. Partial university severe flares access mainly local area, and this occurs as there is at the site of the middle part of the heart where the AV node is. The displaced node that conducts ventricle superiorly gives abnormal access. Echocardiography, this will delineate Mrcpch mainstay of diagnostic investigation. And management significant AST large enough to cause right clinical condition of 19. For second one, AST is by cardiac exercise catheterization with insertion of complete device, but for partial AST, pressure is required. Treatment is usually undertaken at about 3 years, 5 years space, not to prevent right heart failure, weakness, and later. Clinical septal effects, these are common and found for 30% of cases of heart disease does it affect anywhere in the ventricular septum. Any remains adjacent to the tractus from the right now must completely down the person. They can be most conveniently be considered according to size and reasons why we see this one of the larger valve. In diameter, perhaps up to C and L. And the clinical features of the representing the asymptomatic sign line has minimum and lower fluctuating edge, line plus knowledge. White means second sound is obviously second major impact which really to a large part. Large when the objects increase by weight and slow. Mountains and these are shown with murmurs and let's see again. And then the consideration of the labor management and it has to be obviously is written Example facilitation device used to produce supplement drugs of effects. Masturbation such as normally and this is normally to demonstrate the precise level of effect it is possible to assess the effects using drug control. There is no combination of these decisions to increase continuously distribution by the disciplines of the normalization of all other pediatric advances and by normal effort, while the waste discussing prevention of the veteran universes by maintaining good emphasizing rewarding very precise arts actions, large mostly respect them to be the same size of the dead all the clinical features of heart failure metastasis often treated after long period, becoming chest infections, open times, treatment body life for like this of failure, the free body soft consistent one of one and after five, and the illness is one of normal, community so possible child drive, to the black eyes, secretes the lungs, loud pulmonary second sound, inflammation responding to infection life, you see as the second third, abnormal, this is external scars, advanced. Forming of restrictions by vascular malfunction by retina and obesity, cellular tumors such as local habitation, upright tumors in the tummy, restorations on checks radiograph coming in the house, permeabilities exist from the mountains by universities by the habitat by 2 months of age, hypodemonstration of the effect, and the effects and by a should be developed. Drug therapy for the is with Pediatrics often can have technical assistant value with osteoporosis, LSI, communication, communication children large VC and inflammation. They should not be really to research damage with the vascular bed and to prevent this usually from 2 to 6 months of age in order to manage heart failure. And to prevent family damage from primary hypertension and like flow, this is good because it's surgery, but treating vectors also use the doctor surgeries connects to body attitude to the disseminate the interventions management of the working period was filled closed by a midfield after expected to take delivery within 20 meters of the muscle of the flow of the blood across the period is then compared to the body electrified following the following that rest resistance of the birth. Intervention the period is not treated as ability to choose it. This is in the neonatal medicine and clinical presentation presented with complex manual intellectual the moment continues. It is lastly because the short independent energy has lower time that way gets you out the body cycle. The consequences causing relapsing and binary policy which are unusual but when the doctor's large increase primary blood flow with heart failure and volume population. Let me disinfect it treatment. Investigation with chest radiography procedure are usually normal, but the people's large is the features on shown with the video as a normal and just a little the quality is two things that's just possible by the air and the genetic. This is the some make of question based trees or these trees. These are very important, especially the management and like those two has. So these probably does not have these are on the aliens, which also starts the management second one in the student. The solutions to see the issue, she knows the features, the features, and Just really well for ECG are in the source of the human issue that however that is really invalid and never should species that may virus a lot of discovered during the characters of cardiovascular disease, versus the require nutrition, 2G bags introduce that habitat therapy and lifelong with face industries such as violations of life. Nonetheless, some these artists have a common digestion. They have these conditions, the cyanosis, the species, similar to perhaps easier to simplify. Hyperoxygenation of arthritis is sometimes used to help in the various heart disease and assignments renewed. This is in combination of the box responsibility for journalists, just treating and treating at the pressure vision, and that class remains lower. After this time, when the society becomes a job, this is disease, people have the new one of the next year. It could be a full 20, not something to have it, but has a much more of not the other management, sign marriage, reviews, and life away, reading some disease in that condition, misuse of the best infusion 5, in the number to the loop, most of the sun, disease presented in first few days of life, and then bringing this these fixing in the big oxygen and the lungs in the loop. The accessible mentalism of people is key to the survival. These things. So, patients have a physical ability. Appearance of genus and seizure session is a rational operation. So, difference is the most common cause of some other. Congenital heart disease, increasing solutions in heart and that are so cardiac and largely due to by the respective to second. Secondly, species causing death and infection construction. Right clinical habits of food as a result of symptoms. These are an example of synaptic habits for the separation. When the separation between family, blood film, left right across the maintaining the fitness perseverance are the most as I simply profile this intellectual and familiar incubation in the first 2 months of life. Solution at this stage may make the office contact field. For example, stress when the first is price classification, services, having rapid spies, which partly exercise directly late, and friendship is now near trying to countries with still having access to massive traffic of services in not judgment, but isn't that the police have a sort of disguise as the related and infection, same as vaccines and even that affecting to vehicle trends have rapid increases on the same as is usually associated with the ability of the person in crime because of scale, hypoxia, breathlessness, and then pallor because it is residential confusion is encouraged by many of the spell. Signs of illness includes development of singing and loud as harsh is a test for a number of the less turning points from the demon light with diffusion. The right clinical absence of success is predominantly muscular and loaded pulmonary. The normal spirit shocking sinuses will increase. This is the exercise to follow. 4 signs and then it was normal, this is extreme and this is BCG, so rising the hypersensitive hyperactivity in one with no other known as a investigation especially of a left field, short and this one of the speed with an objective because picture quickly rising we have city most money the relation in the baby arrive sided and the cars because of only objective. You can give a left hand order with the left street name and the other in the right hand also track would normally be provided. There may be decreased from the vascular advantage effectively used from the left foot, city and the bird, you have to for older. Everybody left foot is with amongst the common features because other pictures are organized in a really trying to show the detail of that the running athlete not seeing that occupying that runs the issue managing and the definitely says that accessibility was closing ability to lead in right of the that construction sometimes have to see past the next times a possible reward if it's for the place and using only maintain to buy shunt increase the media. This is really done by a shape surgery patient office to do with the suffering athlete early modified biological sun or more. Billion dishes can be surgeon relating to actual types, articulated styles, and several people followed by the sleep. If beyond the 15 minutes, they should be given promptly according to need, with solution, and release water is absent, intelligence depending on alpha algebra secondary abuse, which probably works better than such as fluid vision receptors and vaccinating the subpulmonary muscular attention to process abuse from the better. Intelligence may be used to create acidosis in sick gases not achieved with the basic abnormality, these were knowledge. Teaching the bonds, the teaching to have to see the oldest connected to the giant and the body has been that this body when to go to the connection who like this or don't get the good like state runs when a two parallel connections and systems say that between them solutions incompatible life fortunately the number of national ethics as a anomalies very seriously media as well as the routing innovations which will achieve this maximum image structuring. And this is the features and these are the freedom ways of community found and in accepting not the dignity is the presentation issues in the tool of life and then factor to release to mark production in mixing of these saturated drugs. So this will be less and presentation late there's more mixing writing saturated anomalies such as is the physical science, using presence, second half science often loud. Simple reasonable learning that reduces historical qualities for experiences within the left interplay. From the investigation, just the words will be the classic science finding the phenomenal. So we ask them to make on side and without each other using AP, relationship with weaknesses, now as medical and hypertrophy. And critical respectively. This is normally as to not result commonly to increase that. So this should be normal and the kind of way this is should be the normal actually make sure that it's just the varieties that is when in the sick signage and needs the key is to mixing and giving vacation after the end of the treatment. So the inclusion for the nature sometimes maybe like civil procedure which needs to be for many personal creation usually benefit TGA, capital inflatable renewable and the transport to the available are the more real and then on to the litigation controlling the the beliefs included within the life factor and then go back to the intersecting this towards the intersecting. Then is a fact about the binary incorporate and so those mixing system of the convenience part within the region. And outpatient targeting pre-targeting planning operations is usually the arterial switch procedure may to be this operation performed in first few days from the arterial that transected. Both arteries and veins is switched over. In addition, the coronary arteries have to be transferred across to the new aorta who compass forms and transformation will need alternative patient systems. The complete translation and this is ECG findings of the substitute ECG. So these are the numbers. And Charlie was suffering from terms and his five surgeries, 6 to 9 months of patient, and the new making sinus was no longer best of any infusion. By noon, on shares of testimony and research, patient immediately. Considering the environment, very failure regulations may have known that the SMG is high. Family left it to large left large shoulder problem mixing not treated and need the arteries become technical and resistance. For reasons, rising blood sugar levels spike become less symptomatic as the shunt decreases, and rate about 20% versus on the person confusion as synergic syndrome. This is usually with the second and adult will die in non heart failure after the real both effect of life. People seeing the duration is like condition with early information from high or medium. The transplantation is not readily available, although medication to palliate disease is available. This is Ninja, and from its video references include areas taken by the magazine track experiences. Areas taken to the system of its usual announcement, the areas to the site in the mind of the movie of the art and earth, simplified with common wall between the geometrical which stretches across the entire junction and tends to be. As there is large effect of hypermetric architecture, features of computer intelligence and scheming services and bird or hardware to CD supply. Excuse me, no murmur heard that music that is on the echoes remaining 157 is only suitable dances on the CG management feature, partially related as per last week's system for TV. So the complex nature to having typically generated by this condition, strike a spreadsheets and message vision, but the numbers have changed for combination to present because the main presenting feature of the event of the series is about the year as being from check the Jesus the most common check appreciation is only the left of the better by things one. Okay. Yes, common mixing system videos used to do the actual presentation which is the channel will be the inside the show. That's management early creation as well. Although common mixing complex diseases, the fountain explosive and materials are low pressure. And by a blood doctor session, this into a separate variety, seeing in the the secretary children who are severely raised and for me actually having a opportunity to use for me yeah, right. I thought medicine completely corrective surgery is not possible but you excuse me you can write whatever in the chat box. I can see the chat box. So whatever you guys are writing, don't have to raise your hands or whatever. You can just write it and read it later on or after we are done reading on quick. This is a very quick read, so it doesn't matter. But natural value of appreciation should be reduced. But you see, collective surgery is not possible in this, as there is only one collective functioning ventricle created with a strong blend of frontal patient connective severe and intelligent energy of the substantial areas in the frontal can lead to having connection, operation group, right? The freedom of body depending on the purified. Plus, the liquid becomes blood around the body and systematically special supplies blood to the lungs. Fountain nutrition results in an awesome ideal functional output, but as I wanted to relieve cyanosis and removing the long-term one mode of a single function. Summary from GE supplement plus the type of conditions that use our management, so it's most coming down to those and to work, so teaching makes it, management features are pretty, very particularly emotions and here is compass to solve exactly the same as the research and the opposite informative landing and then surgery blend on which one content on which upper structure in which all experiences for this research about type partition of our unit anti-synthesis and anti-drug movements are thought seems to get together sectors. Exactly in the principle, when we will want to see how the teachers connect us to the family agency and the population and can be available. Additionally, may be association in Japanese social associations population writer as they should always be service. Innovation most teachers present with an asymptomatic normal and the those with severe stationary present with reduced size challenge and stress significantly when we prepare those who prepare to most of the activity system situation representing player affiliate leading to shock for the science knowledge so rated on static cells hours is a performing movement maximum and the light of the right so we be able to make results I guess it's not sign in applicants of the state investigation from the identified case of the sanitation of the America and the party is maybe gets it in the key and in the children. Regular clinical and photography systems supply knowledge assessment, the intervention in symptoms or exercise, or more honestly, higher listing, ensuring more suitable from some of the technology and availability or lottery. Willing by the seniors usually safe and communicated by the leaders is much more difficult images. Most inmates and integrating our communities to provide treatment in first year required immediately required urgent volume placement. Energy benefit of the leading about the first year in these scenarios. This senior settings and for many seniors and family law because of partially pieced together, giving them a certain exit from the right. The communication most highly systematic cyber ability a small number of relates with critical families and society technical family separation and present facilities five cyanosis and rejection system with the first reaction maybe present and injection first at the reaction edge. When spread to prominent type between voices, it's view integration level of questionable condition for the gradation limits density of the TV and the emotionally supporting the pressure. We know fast forward from the was the COVID and luckily because this company increased about 60 or eventually we get transferred when the addition is essentially by years. So at the head issue this information is more technical especially because most many is it is much more common for competition present in the European features is a greater system. Evolution is out on the general officer, which political and your potentially stronger. The information gives you the bread of a single section via the registrations in just one of those supposed in 15. The solution just really want to be approaching to get the large page and the first is running under the range of my person. She says that it is a large business fiber in the southern origin of practices. This is used for the vision of the innovation personal as success better. The standard is that in body with the art and the particular centers which can be for agriculture significant. These is the population function of the art and hyperplastic profit. Freedom categorization as influence with art failure and short ability to analyze findings on anti-vacant other some relationships. The summary is that to your child in the big family sources and population and boundary. Education one upper right small edge and temperature and body smoking one upper left corner edge. No, and both have an variation completion is final delay and stent exposure association type competition and the management is necessity of first between comments at the early opportunity that we can find several surgical. The competition will usually are taking from tissue effective out and just the common social department when that activities the content of the context causing severe exception to the output. This is the most common cause of the have to do with doctor, each examination of first of life is usually normal, history presents the key to the better of activities, security, so have failure against the offenses, and the exceptions of political from how to restaurant is normal management errors. This is seen as a excellent of obstruction, there will be response to the happening first, and the Jackson and the are uncommon with the information between the partners I intended to do the agent. The cardiac output is depending on the isolation. The VST is usually assigned to the patient as well. Talk is made to produce as a complete protection close out the VST. Compared. No, it didn't cause it. And you can talk because of this. days off and association with other conditions, visual syndrome, absence of thymus, pattern effects, immune deficiency hyperglycemia, and chromosome 22 to 11.2 microdeletion. Have you also yet found in this condition they in the development of entire outside of metabolic small acidic and metabolic stimulated, and there is usually metabolic extensive. The centimeters response is almost invariably cartesian clinical features. These must be detected immediately at ultrasound screening. This allows effective counseling and prevents suicide in the domestic. After the demographic final excision such as screening, if you do present with after birth, there's sickest of all units presenting with abdominal sounds. There is no referral to the left side, the hard subductive construction we should perform as it is with other academics. This weakness reactions of all peripheral pulses, sorry. You trust to weak molecular adaptation of AIDA. This is the summary and of complication, disruption of additive complication, and then disruption. And then is hypoplastic. Left. So we will be finishing this today. Hopefully, now the management of this condition consists of a difficult major option triangle. More with positioning that complex lesions are small for gestation age undergo heavy procedures that are combination of cardiovascular surgical condition. This is known for the operation plan of liver content, but also seems to be certain content and about use of basic. Here, following cardiac surgery, most may recommend carefully following cardiac surgery and rank exercises during the month. Exercise tolerance and variable most students are to find the limits restrict exercise and advice only for children with severe residual outer sources in ventricular dysfunction. Also, children follow up with systemic clinics mostly normal and social life, but any changes in symptoms of these psychotic evaluation. The cost of investigation in children and not poison remedies requires vision of the surgery early life. The most common reason for this replacement option was convenient before surgery. Visualizing is usually practitioner. Other business services include evaluation is the psychical change in hardware expansion. There's accelerated acceleration of species for expedition method, changing by up to 30 weeks. And the next super integrated area this is the most common challenge we have a heart rate, we have heard 200 controls per cardiac active. And venous typically with symptoms of hyperemia or your infants because of hydrocephalus judgment that the reintegrate cardiac disease requires a circuit of connection further with the activation rate from via an excessive pathway. This is really a septum heart problem, but electrophoretic usually form. No treatable cardiac as well as evidence specification, which ECG goes only show narrow contested cardiac activity 300. It may possibly discern a PVR activity or extitude to create activation lesion of excessive pathway. In part three is where there may be changes suggested for myocardial ischemia with tibial erosions in the grade 2 pre-convoluted, which when inside them shortly and internal maybe was Wilcox also right syndrome, the early and late grade activation of ventricular wire the pathway results in a short pair interval and then delta wave in a right race complex management. In this really in child, form is crucial for fetal tumor. This is achieved by secretion of quality food, surface is selected, positive pressure ventilation is required. We will simulating the ASPIRANTS to science pathology like start to face excessive in the body because sometimes the venous seems to be tries to seek effective releasing if you want to pull your upper vocal bolus injection then so that you can get a little really circle that is set up between the baby no excessive badness, including increasing like organizing symptoms like kinds of fragile refugee reaction periods. One science is in that these have become defined recognized as social and direction can be used on its own when there is no overall citation rate and believe on the racism open amount of Latin in terms of principles. Even though the things is really normal 90% children have no further types of intimacy and treatment is therefore stopped at one age there is no road of the survival syndrome. Those who have the syndrome need to be sustainable. They cannot forget the in this area and they cannot young is increasing and this will reduce response to sudden veteran suspicions. Those who relapse or exist are usually treated with culture, radio frequency ablation or prior ablation of excess to body. The judgment of being this real condition is the real condition is usually related to the presence of antibodies in the genocide, and this is conjunctive complete connective tissue disorders. Disease never will have they manifest and routine connective tissue for 6 different frequencies are often affected. And this antibody appears to prevent normal development of the electrical conduction system in the heart, developing how it is these electrical courses effect, which is a nerve glucose Totalis and Breckenridge and actually immunity and how most domain symptoms for many men. But if few becomes symptomatic, increasing the relation to be alternative symptoms require surgeon often endocardial pacemaker. There are other claims that there's a complete outbreak of other weakness, longevity, rehabilitation, sudden loss of consciousness, exercise, sensory emotion, music in the childhood. It may be mistaken it's very mistakenly diagnosed as epilepsy. Rabbit and sudden death from antibiotic okay. There are many genetic causes and high risk is autism and tablet. Slaughter there are several phenotypes. It has been associated with euthanizing therapy and electrolyte disorders in heritage. It's one of the group of several pathogens caused by specific gene mutation abnormalities in the same functions, and anyone with a family history of sudden unexplained death or history suspicion to be an observation should be assessed. And this is even research for the topic including cardiology, cardiology, the patient of children with all are there. They are most often seen children with undergo surgery for complete fragility, heart disease. Next one is sympathy, subject versus consciousness is usually sympathy, that is associated with last question three with spontaneous recovery, just caused by transient and brain access therapy generally to impair cerebral perfusions, the common assumption is usually benign, and with fairly due cardiac disease, which may be life threatening because of the reason of the sympathy and its response to a range of provocative applications accessories, there may be spinal activity and something autistic mentality, suicidal blood, university surveillance. Pain, there is usually a version of dizziness and lightheaded feelings and no visions. Often weaknesses that don't peculiar in social inconvenience, things leading to diagnosis of Caesar. In most cases, there is a maladaptive drop in blood pressure in symptom does not solve anything. Other than a few, there is a system. Cardiac syncopy may be irregular from hard work, going to the cardiac and the cardiac society or structure associated with stenosis and particular medical physicians for cardiac as something like exercise, convenience, probably so sudden explain death and population. Check blood pressures and signs of cardiac disease, normal female processes, muscles, muscle or preserving the target blood pressure safely sunlight. CBCG and check the corrective adjustments, feeling into body disease in children. And sorry, these are the chest pain, reading, ladies and only days before palpitation realization, reverse the plastic aggregation, these pain and test usually currently for the investigation. And looking a child with no known heart disease or an exercise time, they should be taken more seriously. Yeah, I know it's been long, but I just have to finish it. Let's just finish it. Those who don't want to attend the labs somewhere to go, we can review it later on YouTube. Symptomatic fever. I'm sorry, I have to finish this today. So, apologize. Symptomatic fever is a multi-system autoimmune response to group A supplemental infection. It really affects to 5 to 10 years of age of like Australia that have disease worldwide. It has estimated that there are approximately 474 lakhs cases. New cases of symptomatic fever and 275,000 deaths attributed to rheumatic heart disease each year. Most are in low or no countries or indigenous populations rate of first by 19 per and my last population the task to the same of less than per explanation is high. The highest is in the low income countries from 0 to 2 mainly relates to the veteranship household outcry. Different security governance was in September by the treatment of different writers is an manageable reducing incidence of 10 decrease of group is a different transformation due to method period. After eliminating challenges, after making internship to the system for representing meningitis or tissue with paradigm, there is an acute minus equal excited in open diagnosis plus coming from protein 7 and failure. The clinical features in examination in begins Nigeria and the beauty and infection. Now, with a infection with three property applications are used for supplying application by the quality history and exam which should be from easily qualified diabetes if possible. Now, the medical person was coming from North Intelligence to Canada House when scanning information in one of the heart, but there has been have been repeated about the medically and the diagnosis here for us only the second of the clarification to design development anxiety and either type and then also now is moving people affected in our type of their own in becoming one disease makes such as what you have been really going right here. Many forms of organization symptoms of cellular penicillin by used by further for the information prevention of needs on women, assuming the need the Jones have the very important things. I guess was the effects who was one major tumor criteria festival because some major manifestations can be digestive distilling, where you get arthritis from the for the middle which motivating, investment is even afterwards as well. And just to show that the aspirin was being used isn't very common, but I don't think so. It's really depressed, like the aspirin has been used to suppress the previous results and that has largely been supposed to be reduction in suicide effects. So it's rare that I guess hospital may need to be treated occasionally before the doctor beginning or that just happens at this point. So this is also the second thing usually managed psychological education, social support and themselves to take carriage with medical counseling has become understood. G as cost of pressure should have been treated. Disease happens in one seriously ugly. And the cancer infection should be proven as nature. As a market for the reason leads to the number of medical also the most effectively achieved what's rejection of density. And so you do benefit even only believe that it's less effective than compliance service. So continue to medication and that's immune free for their transfer of diplomatic field, to it over existing version, then we can exit the areas of the last episode of the very for the 18 warriors, which is in Colorado. Potentially minimizing the pain, especially granting the medical access with continuing endurance and especially when the also the pain is with There is heavily subsequent and including negatives to the devices response number of this. A prevalent jet of blood hospital, the state practitioner have been PDA if this happening of the has been service surgery, it will be clear diagnosed, which could be suspected at any found or other to the system. Fever, malaise, abscess, exercise orientation rate, and hyperemia, and usually returns at the passengers, but it first to know that it should be well. And so this is a few we have big results in covering the topic skin lesions and skin neurological signs from subacute infections and if you have like results of the initially okay. And by using medical blood pressure should be taken for everybody so everything possible regarding to make it so the confirm the diagnosis of pharmaceutical institution but can never be treated. Registration consists of carbon composites and containing factors and factor level. Two for seconds are based on the previous comparison. The factors, the treatment, and the most common for regulated is every medication that could have been seen that they the characteristics received because of high dosage combination of the side in 60s and channels and checking about the same level of the talking flavor. If there is infected prostatic between some more patches chance, there is less chance of complete eradication of the immediate required. The people of the military that can select the antibiotics of the hygiene that can be found by one thing. This is along with the values of 30% factors of the comfort of the whole of the community from most of the conditions. We can require those that have a six factors that have a guide like the public and it is planetary, the previous method in the thing that it is tribute and severe like reducing severe bacteria. Method is a time not that we direct and electric large filling in that it has proven matters of metaphorically on the direct manufacturing effect. No, hiding. Which is effectively showing the last part and have to lay which materials involved. The missile is usually made by photography, video, systematic with dialectics, and this is the girls and find it either well and feedback or Julian, so the call, a junior software application, the minister, the inclusion, the same contribution, no colleges, is increased comprehensive research and implementation. Requires measure position, other community and the principle are there, which are the mutual entity, some of the survey for the career, content and name. And the last one is it's like it's really first size of the points of face, which is very high. It is uncommon knowing no like nature and people in Japan, when submitted of the carriers, which is significant cardiac disease. It is commonly caused by cardiac disease and children who have been taking the cardiac form and that is very close to the teams, which ratio of cardiac infusion and cardiac disease, clinical activity, and the cardiac disease large education. And or place preliminary commuter training point, function, depending on people manage the graphic and the method of representation, their carry risk of timely activity, time people review and evidence to be given. Creating community knowledge intelligence to work for work. Standard of human development survey to channel community to for the 390 features and location requirement health such as factor and flexible first responsible with the subsequent of population operation. So when using have chronic disease need new presentation, the team for this and suspected COVID-19 and everybody of the day has Louis similar power description parameters. Funny how the conditions of the present body as the SLG effective medication investigations can be caused by a number of different diseases in the cardiac perspective. Will shown Becoming a pedestrian library of the city of the single than three thousand allows this type of system. Good library recommends a serious mercy, social policy level of the Muslim city with a different community represented by library pressure. While this building is becoming a project TV, which is not for the police, but for the and that the many various studies are available in the app and from your cyclic cyclic pharmacy, CGMP, African United Asylum Service Services and all of the diocese, then present the result of the claims of indictments of the only was sent down or the trust cycle. It removes the great factors and the cycle. Real allocations. These limitations allow some provision to be delayed for easier. And this is having a film edition for the audio that is provided both similar full type the full type of this will be used in video and sorry, 50% consistent formula edition by bringing this application to a study services for the release from this confession and formula hypertension with explanatory disease. Combination of subtle lung disease and respiratory specific and infectious lung disease and subtle CPAP of the obstruction for membrane disease, chronic inflammatory disease. So this is all really sorry about the first today. Thank you very much.